Good morning, everyone. We will learn the bleeding and hemostasis. Bleeding refers to a phenomenon in which blood flows out after a blood vessel ruptures or breaks. If the wound bleeds heavily and is not stopped in time, it can be life-threatening. Hemostasis is an important measure for rescuing the wounded, and it is necessary to master this technique proficiently in order to timely and accurately perform self-rescue and mutual aid in case of bleeding emergencies. Learning target. 1. Accurately identify the classification of bleeding. 2. Master common methods of hemostasis. Contents. 1. Internal bleeding. 2. External bleeding. 3. Hemostatic methods. 4. Reflection section. 5. Test. Part 1. Internal bleeding. Internal bleeding refers to the flow of blood from blood vessels into tissue gaps or body cavities in the body. Part 2. External bleeding. 1. Arterial bleeding. Arterial blood is bright red in color with a fast bleeding rate. Sometimes it forms a blood column and flows out in a jet shape. The bleeding point is mostly near the heart of the wound. If not stopped in time, it can be life-threatening. 2. Venous bleeding. Venous blood is dark red in color, indicating continuous bleeding, mostly gushing out or slowly flowing out, with bleeding points mostly located at the distal end of the wound. If the bleeding is not stopped in time for a long time, it can also be life-threatening. 3. Capillary bleeding. Capillary blood is bright red in color and slowly seeps out from the wound, often forming blood droplets on the wound's surface and gradually converting into blood flow. The bleeding is not significant and the amount is small. It can often coagulate on its own, and its risk is relatively low. If it is acute bleeding, it must be stopped immediately. The patient should lie flat to prevent shock. 3. Hemostatic methods. 1. Direct compression hemostasis method. Unsuitable for various external injuries. The operation method is to directly apply a clean and soft dressing or towel onto the wound to stop bleeding. 2. Finger pressure hemostasis method refers to the rescuer using their fingers to press the proximal arterial blood vessels at the bleeding side onto the bone, causing occlusion and interruption of blood flow to achieve hemostasis. 3. Finger pressure hemostasis method refers to various small wounds, small arteries, small veins, or capillary bleeding. 1. Dressing should be absolutely or relatively clean, especially when covering one side of the wound. 2. The dressing should be large enough to extend 3 centimeters beyond the wound. 3. The dressing should be as thick as possible. After covering the wound, it is usually fixed with bandages or other bandages. When checking for foreign objects inside the wound, cover the wound with a dressing. Apply pressure directly by hand to compress and bandage. 4. Tamponade hemostasis method. Fill the wound tightly with sterile cotton pads, gauze, etc., and then apply pressure to wrap it with a thin tape or triangular bandage with elasticity to achieve hemostasis. This method is used for medium-sized arteries, injury and bleeding of the large and middle veins, or deep wounds with severe. 5. Tourniquet hemostasis method. The hemostatic method of using a tourniquet is to tie the entire limb at the proximal end of the bleeding side using elastic rubber tubes, soft cloth straps, or triangular bandages folded into cloth straps in order to block arterial blood flow to the limb and prevent blood supply to the distal end, thus achieving the purpose of hemostasis. Part 4. Reflection section. 1. What are the methods for stopping bleeding? 2. What are the types of hemostatic devices that can be used to stop bleeding? 3. Briefly describe the precautions for using a tourniquet to stop bleeding. Part 5. Test. 1. Pressure bandaging hemostasis method, mainly used for limb injuries. Major arterial bleeding. B. Major venous bleeding. C. Minor vascular bleeding or exudation. 2. The position that patients with cerebral hemorrhage should adopt is head low, feet high. B. Head high, feet low. C. Flat position. 3. Under what circumstances should a tourniquet not be used? Upper limb bleeding. B. Head bleeding. C. Lower limb bleeding. The above content is related to bleeding and hemostasis. This class ends here. Thank you everyone. See you next time.